Hello, human body system students. I'm going to talk through what the plan is for Wednesday and Thursday, the 9th and the 10th of December. And we're wrapping up Unit 3. We're done essentially with Unit 3. We're starting Unit 4 and preparing for the quiz that's on Friday over Unit 3. There are study guides at the end. I placed study guides 3.3 and 3.4. I printed these out in class and gave them to people that were in class for this. So you can use these. You can use a note card on the quiz, so be preparing for that. I'm not going to get into too many details about what's going to be on it. Just prepare for a little bit of anything that might be on there. If I look just real quickly at the study guide 3.3, the parts of the respiratory system, the order that things move in through in the respiratory system, how oxygen is transferred in the alveolus, lung capacity terms like vital capacity, residual volume, tidal volume, minute volume, spirometry, and how that relates to detecting how well the respiratory system is working. And those are the main things that relate to it. We also talked about asthma quite a bit and the measurements that were done in the Melissa Martin case. So make sure you're maybe familiar also with some of these complications related to the lung conditions or respiratory system. And then the water study guide is in here. And so the water study guide, you can look at that. And you can also look and see parts of the urinary system, structures of the kidney, the structures of the nephron, and where certain things are filtered in and out of the nephron, ADH versus aldosterone, and then the nephron structure, filtration occurring in the Bowman's capsule, secretion occurring more typically later in the process near the distal tubules, and then reabsorption tends to happen more in the proximal tubules primarily and the loop of Henle, less in the distal tubule than the others. But if you have your poster, you can take a picture of your poster, use the notes that you took from that poster, and that should help you quite a bit. Then urinalysis, looking at results of that and being able to interpret those results and how they relate to a condition. So, quiz will be pretty straightforward. You guys should do okay on that. So that'll be Friday. There's also a Kahoot that you'll be doing, and just make sure that you're, look through that and look at the feedback on the responses on that. So there's a Kahoot. We're probably going to do this in class on Wednesday or Thursday for whatever day you're here. But it's here again if you want to play it. You click on, there's a game pin and a URL. So you should be able to go there and put the URL and just kind of do it at your own pace. So that kind of takes care of preparing for the quiz. Your urinalysis lab should be turned in by the end of the day, Wednesday. So if you have any questions, make sure you email me and contact me about that if you're watching this video on Wednesday. So that should be turned in. We'll kind of address any last lingering questions on that in class Wednesday or Wednesday or Thursday. Okay, so now we're going to start Unit 4, and Unit 4 in courses is movement. So Unit 4, we talk about joints and motion, and last time I did have you kind of start on defining joints. Remember, joints are where two bones come together, and the range of motion is a measurement of what angle to which that joint can extend to when you measure the angle between the two bones that the joint connects. We're talking about fibrous joints being like the joints that connect the bones in the skull, and cartilaginous joints that are joints like between the vertebrae and different other parts of the body. And then synovial joints would be most of the joints we think of, which are fluid-filled joints. We're going to look at a cow elbow in class on Wednesday, Thursday, so you can see what that looks like up close. But hopefully, look at the sketches of the joint, descriptions and the motion. So we're going to take this further. If you've not done this, is something you need to do. First, sketch out each joint using the information from 411. You sketch out, and I would go into the distance learning part of that. Sketch out the different versions, the 6 different synovial joints. Sketch those different joints out, and then describe their motion. All right, you may need to Google a description of the motion, if typically using like regional or directional terms when you do that. Then from there, you're going to identify joints on the human body that fit that category. So kind of going off of this in 411, you're going to find an example of each of the 6 types in the body and label those on the organizer elbow or on the organizer below. So if you put like elbow, you label elbow and then say what kind of joint it was. Okay, so elbow, ball and socket. I'll tell you that's not correct, but you get the idea. All right. So all 6 of those, you need to have one joint from all 6 of these types of synovial joints. Okay. And then the dissecting a joint, you'll watch the video, the diagram of it. You may watch the video of it too, that can kind of help and talk about how it's similar to human elbow. The human elbow, and then when you watch the video, 411, which is located down in the distance learning section here, short video, but watch the video and then answer these questions. It tells you the timestamp too on when those would be. And finally, research some information about ligaments and tendons. And I always think ligaments like to like, because they're connecting ligaments like to like, starts with an L, and they connect bone to bone. The most commonly known ligament is the ACL, anterior cruciate ligament, and that ligament connects the femur essentially to the tibia and in the knee. And so when you see someone tearing their ACL, they're tearing that ligament that allows those 2 bones to move relative to each other. Tendons, 2 types, bone to muscle. All right, so tendons are going to connect bone to muscle. And so the Achilles tendon is often the one that's thought of. The Achilles tendon connects the calf muscle or the gastroc muscle to the heel or the calcaneus. So that muscle, when it contracts, causes the foot to pull. In that case, causes the foot to push downward when you pull the Achilles. So it's pulling it from back, causing it to push down. So people who tear their Achilles tendon cannot basically plant or flex. They're unable to push downward because the connection isn't there. Very painful injury. Takes several months in surgery to heal from. All right. And then finally, what I want you to do is also look into 412, but it's not going to be due. 412 is not going to be due until next Tuesday. I'm going to change the due date on that because we have the test. And so I want to give you guys plenty of time to do that. But for 412, you're going to define some terms related to range of motion. Normally we would do this lab, but I don't think it would be a lab we should probably be doing, because you have to be kind of in close contact with someone and measuring the angle of their motion. It's really hard to measure that on yourself. So you're going to look at defining range of motion using what's called a goniometer and describing how that's used. And then you're going to describe these terms and record a visual of them. So basically, I'd like you to get started on the 412 assignment and get these definitions done. And so if you look in 412 in courses, range of motion, you'll see the reading here. It will help you understand the goniometer and what range of motion are. Talks through a whole scenario and all the movement that you have to do. And so here are those terms, and they're paired together: depression and elevation. So like depression, I'll give you an example of these. So jaw depression, opening, lowering the jaw. All right, elevation is raising the jaw, moving in a superior direction. So describe those motions very briefly, and then make a sketch on the 412, a visual or something that shows how that motion works. Okay. And do that for each of these: rotation, circumduction, flexion, extension, abduction, adduction, and plantar flexion and dorsiflexion. There are other movements besides these, like supination and pronation, but these are the ones we're going to focus on. So once again, describe them and then put a visual for each of those, some sort of drawing that helps you remember it. Here, and I put this resource page in here because I think it will help you visualize some of these as well. So if you want to do like stick figure drawings or whatever helps you remember it. And then finally, a little more information about how to do them, use a goniometer to measure. And if you look in here, there's a video, there's an explanation of that, and a short video that shows how to do that. And then a couple more questions, and another question related to the definition of like the extensor muscle. So what does that mean for an extensor muscle? Well, think about flexion versus extension. What do you think that would mean? And finally, I put some scenarios in here. So you're going to use one of the terms from up here, one of these 10 terms, all right, to just for each of these. So I just use the one opening your mouth to sing. That is, you're going to put the name of the motion in the joint. So the name of the joint would be the jaw or mandible, and in that case it would be depression, mandible or jaw depression. Okay, and so you're just going to put those answers into there. So that's it. That's once again going to be due on Tuesday, and so you have plenty of time to get that done. But we will be spending the majority of class time on Friday taking the test. So I will be. You'll have a little. So I don't want you. Basically, the reason I'm putting it so far out is because I don't want you to focus on this now as much as after you've taken the test. Okay, and we'll get in a little bit of 421 before the break. After that, so and just let me know if you have questions, and make sure you've turned in the 411 assignment into courses. Make sure you turn that in here, bones, joints, action, by the end of the day, Thursday. And then I'll change this range of motion assignment to being due on the 15th. So it's a ways down the road. So basically 411 is the primary thing, getting that completely done, and then getting started on 412. All right, that is all. And reach out to me if you need help studying for that test or have any questions about things. I'll be sure to talk about some of that in class today as well. So, all right, that's it. See you soon.